Hello everybody, welcome back to Modern Dentures. Today we're seeing Keith again. We fitted his dentures last week and today we're in for a aftercare appointment, see how he's been getting on. Haven't spoken to him about it yet, so fingers crossed it's not bad news. Shouldn't be. So yeah, how have you been getting on with them then? Have you had any problems at all?
I've basically kept them in all the time. Apart from Sunday, I took them out just for a little bit, just to give my mouth a rest.
A bit of a rest, yeah.
One tiny edge my tongue's found, but other than that, no problems.
Okay, so no sort of pressure points on any of the gums anywhere?
Not that I'm aware of.
And it's rubbing on your tongue, you can feel
the
it?
tongue sort of, but it hasn't created a sore on the tongue, it's just
annoying. You're just sort of like worrying it with your tongue.
Feel it's there, but otherwise, brilliant.
Been okay?
Yeah.
And eating's been okay, or has that been a little bit tricky, getting used to it? Or?
I think I caught the side of my face just once, but it wasn't a full-on.
Yeah, it was just you just sort of, almost.
Yeah, just sort of.
Yeah.
Thought, but other than that,
and that's quite normal.
Seamless, so, and there's been no movement.
No, okay. And you've been able to get them in and out, okay?
Yeah, when I find where the anchor points are, I can pull on.
Getting used to it, it's a little bit tricky.
Sometimes working out where it is, but otherwise it's been good.
Been good.
Yeah, well pleased.
Oh, awesome. So all I need to do then, if you can take them out for me, and then we'll just check your gums over. Because sometimes patients can get little sore spots and they don't really know, they don't notice it. So it's always good to have a check. There we go. I'll pop them over here for a second. There you go. Excellent. Just pop your head back for me. So all I'm looking for is any sort of pressure points where it might be pinching or rubbing. That's okay. So where do you think your tongue's, is it on the metal bit here, do you think, or do you think it's one of the teeth?
I think it's a metal bit. Just
do you want to pop them back in and then touch it with your tongue, and then I'll see.
So this is the lower one.
That's the lower one.
That's okay.
Oh, it's the top one, is it? Oh, sorry. Oh, it's probably that bit there. In fact, I think I know what that is already, so I'll just show the camera. So it comes up quite high, lingually, around the upper. It's what looks like it's upper left 6 on the left side.
That's there.
It's there, is it, on that front tooth? If you want to pop it in, and then I'll have a little look.
If I put my tongue to where I think it is.
Yeah. It's the tip of your tongue, and it's that bit there.
Yeah,
that's all right. So yeah, there is a little bit of a gap there. And it's just behind this tooth here, so it's sort of down here.
Okay, yeah.
The reason the gap's there is because of the angle of this tooth and the way that it goes in. So, and you get this sometimes, if a tooth's leaning in like that, you're going to have a gap where it's inserted. I'll reduce it down a little bit, smooth it, polish it up, just to see if it feels better. On here, it's this bit here. So normally you wouldn't have that bit because this tooth would be in line with this one, but this tooth is sort of set in at an angle there, so there's a step. So there's, in the mouth, there's like a little bit of a gap in this corner here, which you can feel with his tongue because it's not quite touching the tooth, so the tooth comes over here. And it's like that because the angle of the tooth is over here, so it needs to pass over the incisal edge of the tooth, and then when it's in situ, it's leaving a little bit of a void here. The way I'd get around this is I would take this down so that it's closer to the gum tissue, so it doesn't feel like there's this bit sticking out the side of the tooth. Now hopefully that will work. However, what it can do sometimes, by reducing this down, you're actually making the hole bigger. The other way would be to bring the acrylic right up to the side of that tooth, but that's probably not going to work either because it is going to be in the way of the bite, and where the lower teeth are sitting. They're sitting right up here. You can just see the little marks, indentations there where the lower teeth, and so if we build this out, it's just going to be in the way, and then we can't occlude properly. and we're not weakening the frame here, so you need to obviously consider the strength of the frame. This metal here, this is what's given it strength across there. We didn't have this bit or this bit, this mesh bit wouldn't be supported, and then it would lose its integrity. So as long as you keep probably about 2.5, maybe 3 mil height, then you'll still keep the strength of the denture there. I'm not going full pelt on this when you're trimming metal. You need to keep your burr fairly slow. You also need a sharp tungsten carbide, otherwise it will just blunt it in seconds. You want to keep the burr quite slow because you don't want to heat the metal up. If you get the metal too hot, which is why I've just dipped it in the water there just to cool it down, if the metal gets too hot, it will blow the plastic. I could take some more off, but before I do any more, I'm just going to check it and see if it's feeling better or worse. So it might feel a little bit rough there because I haven't polished it. It might even feel a little bit sharp.
Okay.
But just see if it feels better that it's smaller.
Yeah, slightly less pronounced.
Yeah. So as long as we know we're on the right track, I'll take a little bit more off.
No, I would say that's better. Just,
do you think that's enough?
Yeah. I don't want it to be weakened.
Oh no, it wouldn't be weakened. That gap there is always going to be. There's always going to be a risk of the food getting into a gap. I'll just smooth it off a little bit then, if you're happy with that. And notice there's like a little sharp bit on the tip of this one as well. So when you're polishing metal, you can use little rubber wheels. I prefer these rubber cones. The pink ones are quite smooth and I find them a little bit easier to work, especially in a sort of situation like this. It's easier to get in there with a cone than it is rubber wheel. Although I find that the rubber wheels are better, or they're a little bit more easy to use if you're polishing a clasp or something like that. They can be a little bit easier. This isn't going to put a high shine on the metal, but it will take off the sharp, rough edges. And again, just need to be careful that you're not getting the metal too hot when you're polishing. I'm just going to polish across the top of this bit because I just did this a little bit as well. And then after that, I'm just going to go in with one of these. Again with this really slow speed. And this is just it's more for the plastic than the metal. And I didn't really touch the plastic, but just in case. By the way, for cleaning the dentures, when I'm cleaning them off, especially if I'm polishing them, I use a nail brush. I got told off for using a nail brush, having a nail brush in here, because I think they thought that I was using it to clean my nails. But I'm not. It's literally just for the dentures, and we only use it for that. So when I'm not in here, obviously we put that away so nobody else comes in and uses it for cleaning their nails. But it works better. I find it works better than a denture brush or toothbrush or something like that, just because of the amount of bristles on it and the way that you can hold it quite tight, and just for like stabbing in to get the little bits out between the teeth, works really well for me. There we go then. If you want to pop those back in, all the gums are nice and clear and healthy looking. And again, just for you guys, I always check the mouth after I've fitted a denture on that aftercare, even if the patient says they haven't had any problems, because sometimes they don't feel that it's pinching or rubbing, maybe due to medications, or everybody's got different pain thresholds. But the other thing is, sometimes they don't like to say. They might say, oh yeah, no, they've been wonderful, when really they're hurting, but they might be too embarrassed to say. So it's always good practice just to check everything, make sure that there isn't anything causing problems. Okay, so I hope you found that video useful, and we did a good job on the denture, so that's always good. I had to do a couple of adjustments, which was good as well, otherwise it wouldn't have been much of a video if we didn't have to do anything. Thanks for that, guys, and we'll see you in the next one.